Good day, everybody. Welcome to Dr. Tom's Tips on Tuesdays. Today, what we're going to be doing is we are going to be recapping and highlighting the most recent case that Dr. Hirsch took us through. As you've all have seen, there were 5 episodes, and what he did was he took us through the beginning to end of an actual case that he did.
Right.
Good morning, Dr. Hirsch. How are you, sir?
Hey, Rolando. Good morning, everybody. Welcome to Tuesday. Beautiful day. Getting towards the end of the year.
Yeah, it sounds like you have a little bit of cold. Is that it?
I got a cold, and I never, ever get a cold. I haven't had a cold in 10 or 15 years, and how I got this one is beyond me. Must have been kissing a lot of frogs or something. I don't know.
Well, but hey, thanks for joining us. Really appreciate it. So before we begin,
I'm drinking my hot tea and my lemon, my honey.
So before we jump in here, when you've been in practice, oh my goodness, 40 almost 50 years, and
I've been in practice half a century. My God, can you believe that? 50 years. Wow.
But that's huge, because here's the thing. Before you start a case, what's a key thing that you'd like our viewers to understand that has helped you maintain a thriving practice? What are the key things that you'd tell people to think about before they start their cases?
Okay, here's a really key factor for you. I don't even think I mentioned this. You need to slow down to go faster. And so what I mean by that is slow down, take your time, plan everything. You want to make sure that now my computer screen just did something to me. Hang on for a second. There we are. Slow down and take your time. You want to make sure that you've planned everything thoroughly. So the first thing that you need to do is a good, thorough treatment plan. Plan this case out from the very beginning. Your patient comes in, it's a new patient or whatever it happens to be. Plan the case, treatment plan it, present the finances of the patients, get some signed documentation that you need to do. All the things that you're taught in school, just follow through with that. Don't rush into things until you know what you're going to do. So planning is critical. So when I plan a case, for instance, this one, in the planning of this case, he needed an onlay. So what I ended up doing is I looked at the whole mouth, I looked at the situation, and I determined that, okay, this is what we're going to do an onlay. So critically to this one particular case is my time and the patient's time.
Hirsch, if I understand correctly, in this case, originally your patient was indicated or was told he needed a crown, and you decided to not do that crown and go a different route and do an onlay, and then decided to add an inlay. Take us through that. What was that all about?
Okay, so conserve as much tooth structure as you possibly can. You take advantage of bonding to enamel. It's strong, it's strength. So rather than doing a full coverage crown where you cut the whole thing away, try and save some tooth structure so that if you have to go back and test vitality later on in the future, you've actually got a really good way to test the vitality. So that was number one. And number two, I noticed that the restoration next to it, even though it technically didn't need to be done today, it's going to need to be done in a year or two. So if I've got 2 things that I can do rather than one thing, I'm going to do those both for several reasons. A primary reason is utilization of my time. I want to utilize my time as productively as possible. So if I can do 2 restorations rather than 1 restoration, justified restorations, don't create business for yourself, then go ahead and do this, because A, you're going to save yourself 1 or 2 appointments, and B, you're going to save the patient 1 or 2 appointments. And believe it or not, their time is just as valuable, if not more so, than yours. So you're doing them a really good service if you can do 2 restorations or 3 restorations or a quadrant all at the same time, rather than having them come back for this appointment and another appointment and another appointment. Patients like that.
And I like the context around time, because when you did your treatment plan, you literally went a different route because you wanted to take into consideration, hey, you know what? And I love what you said. It didn't necessarily need to be done, but you could see that it was on its way. Now,
it's on its way. Absolutely.
When you did your treatment plan after that, you employed, as you were prepping your case, anesthesia, intraosseous anesthesia, because of time. Is that right?
Yep. So, time is the one thing we never get back. So you want to maximize your time and you want to work as efficiently as possible. I can give a mandibular block, and I do that all the time, but then a patient is numb for a considerable amount of time. The onset of action of the anesthetic takes time, so I employed a technique, intraosseous anesthesia, which gives me instant anesthesia. I mean, they're numb, boom, right now. I give them a shot and I go to work. There's no second guessing this thing. Are they numb? Are they not numb? Do I have to wait? Do I wait 5 minutes, 10 minutes, 15 minutes, 20 minutes? Do I have to go back and reshoot and reshoot and reshoot? That's just really not productive time. And that, if you do that at the beginning of the day, it can throw your whole day off. So on a mandibular block or a mandibular situation, working on 1 or 2 or 3 teeth, I will do intraosseous anesthesia whenever I can.
And I like the fact you mentioned before, I think during the actual case, you're saving 5 to 10 minutes. In a day, if you are treating 6 patients, that's a 30, 40-minute block.
Yeah. I'm saving a minimum of 5 or 10 minutes. We've all given inferior alveolar blocks that take a half an hour to work. You know, you don't have that luxury of time. You just don't have the luxury of time. So I say slow down to go faster, slow down, give the anesthetic, but give the anesthetic in a way that's going to work quickly.
And then get going. Now,
and then get going.
When you started prepping the tooth, there were a couple things that you highlighted that you said were absolutely important. What are the key things that, 1 or 2 things that people need to understand as they're prepping the teeth, regardless?
Okay. So when you're prepping your tooth structure is prime. You know, you only have so much tooth structure. You want to conserve as much as you possibly can. So be conservative on your preparation. Save that tooth structure. Leave as much as you possibly can. You know, God created this, or whoever we believe created teeth and enamel and dentin. You know, that being made it perfect. And, you know, really, you know, we have a hard press to improve on what nature has given us. So be kind to nature's structures and save those things.
So be minimally, well, do what you can to
minimally invasive. Be minimally invasive.
Yeah, and do that. Now, it's interesting as I was watching you doing your case, when you did your digital process, when you did your digitization or you did your scanning, there were a couple of things that you did that I haven't seen other people do. Why? And you made this concept around giving yourself room. What was that all about when you're actually scanning? What are some of the key takeaways for, I guess, effective scanning, and then, you know, doing it so you don't end up messing up?
Okay. Just as in taking a physical impression, if you're taking an analog physical impression or if you're taking a digital impression, number 1, you've got to see the margins in order to get a good impression. If you can't see your margins, don't even bother to take an impression, be it physically, digitally. Just don't do it. Make sure that you retract your tissue properly. If you have to get rid of tissue in order to do that with a laser, with a diamond instrument to be able to see your margins, do that. And then make sure that I almost always double retract the tissue with a super tiny thin cord, and then I go back with a thicker cord. But I want to make sure that there's no bleeding. So you use your hemostatic agents, whatever they happen to be. There's a bunch of them on the market. We won't even get into that. No bleeding, clean, sharp impressions. And when you're scanning, make sure that you take the time to go back and look at your scan, rotate that around so that you can see if you've got the distal aspect or the distal contact point of the most anterior tooth. Make sure you've got everything that you need to fabricate a good restoration so that you or your laboratory doesn't have to guess. Guessing comes back to haunt you and makes your life miserable.
Now, a quick aside, a lot of people invest in, you know, CEREC or digital impressioning systems, and they don't use them. How did you incorporate this, and why, what advice would you give people so that they don't end up investing in this and then not using it?
Take your courses, go in there, learn how to use what you've got. I mean, I've got all kinds of great technology in the office, and I utilize it. I've got a 3D scanner. We sit down there and we take 3D images. We import them into our CEREC machine. Invest in the technology. God, it's out there, and it makes your life so much easier. And it'll make you a better dentist. It'll make you more profitable. I mean,
but wait, you're busy. How do you make time to do that? I hear people saying, I'm just too busy.
You know what? Too busy for what? Too busy for what? Too busy to improve your career? Come on. You can't be too busy to improve your career. I take all kinds of CEUs. It's a matter of balance. You have to balance family, business, pleasure, vacation. You just balance it. You find out. It's real easy to go online and look at a YouTube video in the middle of a day. I mean, you can start this thing and you got 5 or 10 minutes. You can look at this YouTube video. There's all kinds of great information on YouTube to teach you how to be a little bit better at what you do. There's a ton of courses out there. We all need to get our CEUs, so you can get your CEUs by going online and looking at stuff. You have to learn.
I love that. I love it. Because the other thing too is I noticed is after you digitally scanned and milled your restorations, you were the one who actually went through and created that restoration. Yeah. What are tips? What are specific pieces of advice that you would give young all dentists with regard to creating that restoration so that it's what you need?
You know what? I did that. I don't always do it. I sit down there. I'm busy too. So sometimes I'll do my restorations, and I won't make them in the mouth. I'll send them to my laboratory, depending on the complexity of the case and how many units I'm doing. Honestly, if I've got a patient and let's say I've got a quadrant of inlays or onlays that I'm going to do, I know that I'm going to spend a lot longer in the mouth if I'm making each one individually in the mouth. So I'll send those to the laboratory. It's a balance. You look at the case, single restoration, slam dunk, do it in the office, be over, said, and done. 2 restorations, okay. You can still make those in the office, over, said, and done. It just takes a little bit more work. But when I start getting in more complex situations, utilize your laboratory. They're going to get this job done, even though that might take 2 appointments. Utilize them. You'll get a beautiful restoration, and your time is money too, so you can spend your time depending on the busyness of your schedule. So it's a balance. If you got an open schedule and you got lots of time, young dentist starting out, you got an open schedule, you got lots of time. Don't be lazy. Make the thing. Spend the time, design it, mill it, manufacture it, polish it yourself, learn how to polish it. I polished those restorations, but I've trained my assistant so well, they do a better job than I do. Train your staff.
I love that. I love the context that if you have the system, use it, but don't feel you have to use it. Depending on the complexity of the case and depending on how many different restorations, you can still send it out to the lab. And that's a really, I like that tip, because a lot of people think, well, I have to use this. They get stuck in there. Now it's like, you know what? Really, really busy. Let's go ahead and kick it out. Finally,
here's the deal. Here's the deal. I've been doing this for so long. Sometimes I just don't feel like I want to be a lab man. And if I don't feel like I want to be a lab man, I'm not going to do a good job. So I've got great ceramists, great technicians. I rely on them a lot.
So I'm hearing that it's not just about taking the technology and depending solely 100% of that. You still have the ability to go to your ceramists, your local labs, to create things for you in the event that either it's complex, you want them to do it, or you just don't feel like doing it. Is that what I'm hearing?
Exactly. And here's the thing with digital impressions. God, I implore you, get a scanner. They're cheap enough these days. You can get an expensive one, you can get a cheap one, but my word, all you have to do is scan this thing, go in there, hit a button, and it's bye-bye, and it's in the laboratory in 5 minutes. I mean, my God, how easy is that? And they can have it back to you in a couple of days.
I love that. So the final piece is, I was watching as you're finishing and delivering, there are also a couple steps with regard to the preparation, with regard to the sequence of how you do it. You use glycerin for sensitivity, I think, or all that type of stuff. What are the key things with regarding to efficient, effective delivery and finishing?
Okay, efficient, effective, immediate dent and seal. You all heard me talk about that. IDS, you know all about it. If you don't know about that, YouTube it. Immediate Dent and Seal. Pasquale Monnier, probably one of the godfathers of immediate dent and sealing. YouTube him, Google him, learn about immediate dent and sealing, learn about its strengths and its benefits. It's phenomenal. So that's number one, your immediate dent and seal. What was the question again?
So what are key things to remember in effective and efficient delivery and finishing when you're done with your case? Okay. So immediate dent and seal. So you don't
do immediate dent and sealing. And then the second thing that people really forget to do is the oxygen inhibited layer. Sometimes they forget about that. The cement is just not set where the oxygen is. So go back and put some glycerin around the margins, light cure it again. Those are just little tricks.
It just makes it easy.
Yeah.
So at the end of this whole process, that entire procedure, although you split it up into 5 different sections, it took you, what, maybe an hour or so. We spent a bit of time. What are some final things that you'd want to share with people with regard to treatment planning and delivering restorations for their patients so that 40, 50 years from now, they're still doing it and loving it the way you do?
Plan. Yeah, do your treatment plan, get a total complete treatment plan before you ever start so everybody knows what's going to happen. So that means look at the entire mouth, plan the entire mouth. And even if you don't do the entire mouth now, you've got the mouth in the bank for when it's slow. You know, sometimes they're slow, sometimes they're fast. I look at restorations, old amalgam restorations, and sometimes, you know, I got a mouthful of old amalgam restorations and they're expanding and they're old and they're worn, but damn, they've been there for 30 or 40 or 50 years. And you know these things are going to go, you know they're going to break, but you know you're slammed and you're busy right now. Let your patients know what's happening with these teeth. And this is my bank. This is my go-to bank for when I get slow. I get slow, all of a sudden the patient comes in for a hygiene check. You know what? These amalgams that we've been watching, they need to be replaced with some composites, with some inlays, with some onlays, with some crowns, whatever that happens to be. Now's the time to do it. You know, put that in the bank, plant the seed, let it grow, harvest it when you need to harvest it. I mean, sometimes that crop has to come in and it's been a dry year and hey, I need some crops to come in. Harvest that crop.
Take the time.
Whether it needs to be done today or it's going to have to be done a year from now, there's not a whole lot of difference between today and a year from now. Do it now if you need it. So
well,
that's
first of all,
yeah.
I love the context around that. I love the fact that it's not about what's today. It's about taking the time to kind of look peripherally in front, behind, around you with regard to what you're trying to do. Exactly. In watching the cases, I think there's so many things that you don't even realize that you're doing. And hopefully people watching this and observing you doing your cases, you have the opportunity to do that. Yeah. Dr. Hirsch, thank you for joining us. Thank you for taking the time.
Wonderful to chat with you.
I know you're incredibly busy. You have a little cold going and you're still doing this. I love the passion that you have for what you're doing and that you're always willing to share. So thank you for that. Doing anything fun for the holidays?
Yeah, I'm about to go in and extract 2 teeth and graft and get ready for implants.
There you go.
Yeah, actually, you know what? I'm going to Tahiti.
There you go. All right, right on.
I'm actually taking a week off, and I'm going to Tahiti.
Oh, right on. Well, have a wonderful
time. How about you? What are you doing? Any plans?
You know what? Always have something to do because holidays are awesome. Weekends are awesome. Yep. By the way, hey, folks, when or if you have questions for Dr. Hirsch, please ask us and take the time to do that. Also, check out, we have an empowered dentistry community where we're sharing this kind of information. The purpose of that is to give people insight, access to experts like Dr. Hirsch and others in our industry. So take the time to do that. If you like this stuff, let us know. If you have questions for us or any questions for Dr. Tom, let us know. Dr. Hirsch, thank you so much for joining us. Look forward to our next series. And if we don't talk, have a blast in Tahiti. Don't get burnt.
Thank you very much. Merry Christmas, Happy Holidays, Happy New Year, and all the other holidays that come into that I haven't mentioned. Bye, everybody.
Thank you, sir. See you. Bye.